Sometimes I experience neck and back pain after a long day at work, especially after having, like a couple patients for more than an hour or two. I like to go home and stretch, but I definitely think that over the years and, using loops and trying to get different angles all the time, I think that's going to add up. Now I wake up in the morning and I'm okay, but I know after a long day, like I go home and I'm tired, my neck aches, my back aches. I definitely like to crack my neck a lot to get some relief during the day. But yeah, this scope, it makes it easier to just sit up, and it also just makes it easier to look under or over it a little bit, over the field of vision, so you could look at your instruments, you can see what you're doing, you can go back and forth from the scope and the patient, and it's more cohesive than trying to look over loops. You barely have to tilt your head and you can make eye contact with someone a lot easier. So with my loops, sometimes I change them out 2.5 to 3.5 to maybe a little bit more if I'm doing endo or something like that. With this, it's nice that you're able to just tell it what to do. You can zoom in at whatever number range, I think between 1 and 100. It's nice to be able to talk to the scope and say, hey, scope, zoom in 10, and it actually does that. And it's also nice to change the light. The size is actually pretty good. It fits in your hand pretty easily, and then there's one button that you can kind of move, shift around. You can bring it down to like the patient's chest and look up if you're doing like a maxillary tooth. So you don't really have to, kind of bend over backwards, and you're using the scope and its arm to make all those maneuvers for you. It definitely replaces the lights. The scope's lights are actually really, really nice, and like the wavelengths of them are good. So what I'm seeing is pretty much what you're looking at in the mouth also. After about 20-30 minutes of training last time with you guys, I'm a lot more comfortable today using it again. And even today, look, actually on a real patient for the first time, it didn't take too long to adjust to that. It's pretty good and pretty accurate with, where you're drilling, what you're drilling, and also you don't really lose tactile sense at all. The image is actually crystal clear, and it has a lot of adjustments, and you can save the settings on there for you so multiple people can use the same scope. And you just kind of pick your settings and readjust, and then go about your day. The headset's actually really comfortable, and there's 2 adjustments on there, and I can use my glasses too, so I don't have to take my glasses off and put on prescription glasses with that too. I would definitely recommend this to dentists who aren't using loops. You could also, the initial setting is pretty much the same range looking at a patient without loops, and then once you start playing with the zoom, I think a lot of things get easier with it. So I think people are gonna want to use the zoom features as much as possible on this. I think that the patient care and using microscopy and zoom features, teeth are pretty small, so especially if you're doing like root canals or trying to get like a distal margin to be like 1 or 1.5 millimeters, it's really tough to see, and you don't want to be going back and forth with your loops either. So I think being able to zoom in as much as you can, especially like 20x, you feel like you're on top of the tooth, and you can definitely do way nicer preps. You can find that MB2 canal, and you can definitely like see a lot better. And also using the mirror with the scope is nice too, because the scope, that doesn't, like, nothing goes wrong with using the mirror. It's still just as nice as if you were like using loops. Using voice command opens up hundreds of different options, and one nice one was being able to tell it to start a video, especially during a procedure. So if you have a difficult procedure and you want to video what's going on, you can do that. You can send it to your friends a couple states away and be like, hey, can you help me out with this? Like, I don't know what's going on. You can probably do that in real time too. So you can get the help you need with a procedure really quickly, or also patient education. If you want to just video and be like, the patient's like, oh, what the heck was I doing today? Like, what did you do to me? And I'm like, here you go. Like, this is everything step by step. And then patients also understand the treatment that they're getting and what's going on.